All right, we now have the Christchurch GP Angus Chambers on the line, and he's a very busy man, so let's cross to him right away. Hi, Angus.
G'day.
G'day. Really good of you to talk, and I know you're squeezed, which is the whole point of the interview. Just tell me, you've said a bit in the last week, the system is in crisis, isn't it?
Well, I think it's groaning under the pressure. Yes, I would say there's a crisis going on. I think there's a real trouble with people accessing healthcare at the moment, and it's not really good for anyone.
Now, I mentioned earlier that it sounds like what you're saying is people are trying to get GPs, they can't even get in to see them, so they're going to ED. ED's saying, go back to your doctor, and then there's big long waiting list in after-hours clinics.
Well, that's right. So I actually work in what we call an urgent care centre. So we've got a general practice base, but we also do what is called urgent care in the sector, which is people who need care. Well, in their perception, urgently, but it's not always urgent. And so we actually take overflows from other practices. Tourists, people visiting who can't get to see doctors. So we play quite an important role in the system, relieving some of the pressure on the emergency departments.
And this is the Riccarton Clinic you're referring to?
Yeah, the Riccarton Clinic is one of the 3 urgent care centres in Christchurch.
And of course, Christchurch Hospital, there's no secret about the fact that they have been struggling this winter, and there has been this media coined term, the twindemic, but it is a factor, isn't it? It's flu and COVID. But we survived we got through the last 2 years, probably not great. But so why is everything crumbling so badly this year?
Well, look, there's a whole lot of factors coming together, and certainly it's a big flu season because for 2 years we haven't had in the community, so it's probably been some waning natural immunity, and there's that factor, yes, and COVID. So those two are definitely, and of course there are multiple other respiratory viruses, so there's certainly a lot at the moment. But I guess the other factor is there's quite a significant shortage of doctors, full stop, at general practitioners in particular. So, I think in Christchurch we've got 50% of our practices are not enrolling people anymore. They haven't got any capacity to take people on. So
really,
people, look, and this is not unusual around the country because you can only see so many people, and it's not realistic to just take on more people than you can actually provide a good service for. So so there's a whole lot of factors that have come into that, and that's poor planning and lack of strategy around doctor training, and perhaps some ideological views that that's not helpful. They're retiring because they're getting older. The pipeline for doctors coming into the country has dried up over 2 years because of all the MIQ and immigration stuff, and we are very heavily reliant on overseas trained doctors and nurses, by the way. And we've got a growing population, so more people, the same numbers of doctors. People are getting older, more complex care. There's more tests we can do, more interventions we can do. Just everywhere we look, there's increasing demand for the services that we provide.
And I think you mentioned a couple of days ago in the media about the situation with flu vaccinations. Am I right in saying that you didn't really have the capacity to keep doing those because you were so overwhelmed with patients, correct?
Well, what I was saying is that they've expanded the criteria, which actually in the medium to long term is a good thing, but actually doing it now is probably not going to make a lot of difference to the next few weeks. So it's kind of like they're scrambling around trying to appear as if they're doing something. And then, they're wanting us to do a whole lot more vaccination on an already stretched workforce. So
it's an unrealistic demand. Another pressure.
We're going to do our best. We're going to do our best to do it because it's the right thing to do. And you'll find, we do a lot of trying to do the right things to do, even though it might not be, all that sustainable. But I think people will. That some people certainly will not be able to do it. We're going to do our best, but we'll actually have to try and find extra staff to do it, and that is very hard. At the moment.
Where do you turn to?
Yeah, exactly.
Dreadful. Do you think people are needle shy now? They're just so fed up with being told to vax that they're just like, I don't want to get a flu jab because for God's sake, I still got COVID really bad and I had 3 of those blinking things.
Yeah, I think there's probably an element of that. And look, the kind of concerns about vaccination. They're not a new thing, I guess there's quite a complexity in it. I think you'd probably argue that the reasons for getting COVID vaccination is so that we don't end up in hospital, and it's not that great at stopping you getting the disease. So
it's not.
And, no, but I think it has done a very good job of preventing hospitalisations. And if you compare, our experience with overseas before there was vaccination, you had bodies in refrigerated trucks because there were so many deaths and that sort of stuff. Now, it's not. It'd be nice if it would stop the disease, but clearly it's not perfect at that. But it is. I think the evidence is there that it's very good at stopping people ending up in hospital.
Yeah, and I guess in the future, I mean, COVID's newish, and as a lot of people are saying, it's just getting started, which is deeply depressing to hear that perspective. Do you think that as well? Really?
Well, yes. I mean, the coronaviruses have been around for ages. I mean, we've known about them for long term. This is a novel one, obviously. It's not. Yeah, I think everybody would agree it's not going to go away, but I think over time we hope it would ameliorate and become less virulent. And we've got such high levels of vaccination at the moment that hospitals haven't been overwhelmed by COVID. It's getting overwhelmed by other things now as well as that. But
that's right.
And yes, I think the future is there.
I know. And so, Angus, is it mostly influenza that's the big issue, or are you finding a whole lot of other nasty bugs out there that are landing people in hospital or urgent care clinics?
Yeah, to be blunt, it's hard for us to know because these viruses present pretty much the same way. You can't pick if somebody's got one virus or another by looking at a person. So, our decision-making process is more around, are you that unwell you need to go hospital, or actually can you do okay at home, and let's see if we can help you feel better while you get rid of it. There is the ability to do swabs that show what type of virus people have, but that's never really been available in primary care, and in fact, has that been actively discouraged? Although we have just yesterday heard that there'll be a very limited number of swabs been made available to people. So if it would change your clinical decision making, well, to be blunt, it probably won't. If you're sick, you go to hospital, and if you're not that bad, you stay at home.
Yeah. Okay. And do you? I guess as a GP and you're on the Christchurch Primary Health Organisation. You're the chair. So I guess there's this feeling of deep frustration and empathy with your patients. I suppose some days you just feel like I can't help you as much as I would like, or our staff can't.
Yeah, look, small correction there. I'm no longer the chair. I'm the deputy chair.
Oh,
but,
okay.
Just to be not want to have ideas above my station.
Yes. Okay.
But yeah, look, absolutely. I mean, we can't offer people appointments. Sometimes, and look, not our clinic, it's probably 1 or 2 weeks at the moment for an appointment that they want, but other clinics we've heard 6, 8 weeks, and that's terrible. And okay, we have this kind of queuing system, so if people have to be seen, they get seen. So, but look, I mean, all throughout the system, you're seeing people having prolonged waits. Being
how long are we talking? Are we really talking 4 to 6 hour waits?
Oh, easily, and through the country, of course.
Yeah, right.
Longer in some of the places. So yeah, I mean, we're certainly having 3-hour waits at our places, and it varies. Some days it's not bad, and some days it's terrible.
Yeah, and imagine it, because you've got sick people. You're all crowded into a room. Everyone's fed up. People are lying on the floor. There's people probably being sick. It's just, I mean, what a great way for germs to spread even further, while your poor staff are trying to keep everything running and help these people.
Well, that's right. It's pretty difficult, and yeah, it's certainly put some people coming off because they think it's not safe, and maybe they're right. And gosh, imagine being a parent with a toddler who's sick, sitting for 3 hours. I mean, it's a nightmare for some people.
It is. That's excruciating, and dealing with a pretty cold winter as well. I don't know what Christchurch has been like, but we've had some hellishly cold days in the south recently in Queenstown.
Same.
Which you would like to think would kill bugs. I always heard that if you had cold winters, that was a good thing rather than being too humid.
Yeah, look, I'm not really sure of the evidence for that. What we do know, though, is when people are in close quarters, they spread bugs more easily, and if it's cold, you spend more time inside, and then, it's a vicious cycle. The more people get sick, the more people get sick. So
True.
I think it's more it's the close contact. If you're spread out and well ventilated, these bugs don't spread nearly so easily.
Yes. How are you coping with staff? I know you've got to go, but staff illnesses, obviously they're getting sick as well. Are you finding that COVID's taking them out a lot, or is it more flu?
Oh, a bit of both. Like, we've got 2 doctors off at the moment with COVID infection, so there's a week, and I've had to work some extra hours because of it, which, that's okay, but takes its toll in the end. And then, yes, definitely the people with flu and, and there's all the other health things that happen. Another staff member has had an operation, it's just
life.
It's life. And then, as you're probably aware, there's a very substantial pay gap between the secondary care nurses and primary care now, and it's going to get much bigger. So there's real pressure on our nursing workforce, and the candidates, when we seek them, are becoming much fewer. So it's it's definitely becoming quite hard to staff.
So just finally, the reforms for the health system, you say that's all well and good, but what's happening on the front line? What's happening right now?
Yes, well, I mean, perhaps I shouldn't be too cynical, but I think the amount of money the amount of money that's been invested in these reforms, and the opportunity cost of taking vast number of people away from trying to improve healthcare into managing reforms is quite concerning. And you would wonder if the issues of access to healthcare and addressing the equity issues of disparate health outcomes between, especially Māori Pacifica, and the rest of the population, could have been addressed by actually investing that money in the frontline services wherever they are. And look, we know that investing in primary care, for every dollar you put in, you probably save between $4 and $10 down the line. But and there's a lot of rhetoric around that type of investment, but it just doesn't happen. It's such a hospital-centric system, and it's very hard to see that changing, but we live in hope.
Yeah, I'll bet. It's hard to find hope in the middle of a winter like this, though, isn't it? It really is a cracker on several fronts, and not a good cracker. Yep. It's just a perfect storm, isn't it? I really hope that things improve, and it's been great to talk to you, Angus. Maybe in a month we might have a nicer conversation that things, we're a little bit more out of the woods. Let's hope so, hey? But
we shall see. I suspect it will die down a bit, but actually it's hard to say that for sure. So thanks for your time too, Leanne.
Oh, I really appreciate it. Take care. All the best, Angus Chambers, on the front line in the health system at the Riccarton Clinic in Christchurch, doing his very best in very difficult circumstances to see patients, to keep on top of things. Staff down with COVID. What a nightmare. These people deserve so much more money. Pay them more and help people out. You imagine it. What a nightmare. All right.